Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Shasha Karmila binti Yahya. My matric number is 25DDT21F1033. My partner name is Huda Najihah binti Suhaimi. Her matric number is 25DDT21F1010. We will present about heart service. So this is introduction about heart service that we choose. Heart service is heart professionals, organization, and ancillary heart care workers who offer medical care to individuals in need set up the heart service. Patients, families, communities, and populations all benefit from heart care. They cover home, hospital, diagnostic, primary, preventive, rehabilitative, long-term, and emergency care. These programs are focused on providing patients with high quality, easily accessible health care to successfully deliver health service. A wide range of care and providers are required. Next is organization structure. Organization structure have heart department management. Second is primary care management. Under the primary care management have divided to three. First, medical management of general heart zone. Second is nursing coordinator. And last one is administration. Under the medical management of general heart zone has primary care doctors and pediatric primary care doctors. Under the nursing coordinator have nurse, midwife, social worker, and auxiliary nursing technicians.
Next, for function and services, the first one is environmental health assessment. The impact of factors on public health are evaluated by health services, monitoring the quality of the air and water, gauging pollution exposure, and detecting health hazards linked to environmental variables are all part of this process. Two, disease surveillance, which is critical natural data are used by health services to monitor the spread of illnesses that are impacted by environmental conditions. In locations where outbreaks are likely, this includes keeping an eye on waterborne illnesses like cholera and cholera-related vector-borne illnesses like malaria and Zika. Third, early warning system. To provide early warning system for natural catastrophes like floods, storms, and heat waves, health services work with environmental organizations. They prepare healthcare institutions for crisis response and deliver timely notifications to the general population. Next, for public health education, environmental information is used by health services to inform the public about the health hazards linked with environmental elements. They encourage healthy habits and after guidance on safety precautions in times of environmental crisis. Fifth, emergency medical response. In the event of natural disaster, health services deploy emergency medical teams and resources to affected areas. They provide urgent medical care, including treatment of injuries and evacuation of vulnerable populations. Next, resource allocation. Healthcare institutions' access to vital natural resources like clean water and energy is evaluated by health services. Even in times of resource limitation, the provisions of healthcare can continue thanks to this knowledge. Next is environmental impact assessment. Health services examine the health effects of significant projects, such building or industrial activity, and suggest mitigation measures in collaboration with environmental authorities. A is climate change adaptation. Health services create adaptation plans for the health issues brought on by climate change, such as heat-related illness and changing infectious disease trends.
Next is epidemiological research. Research is done by health services to determine how surroundings affect health outcomes, to spot new illnesses and trends in the health sector. They employ crucial natural information. 10. Health policy development. Environmental agencies and health services work together to create environmental and public health policy. They support laws that lessen the threat to public health posed by the environment. And the last one is community health programs, which is to promote ethical behavior and enhance public knowledge of environmental concerns. Health services work with communities. They could assist campaigns like the adoption of clean energy or trash management. Next is ISO related to health services. There are 6 ISO that related to health services. The first one is ISO 9001 Standard Quality Management System, which is organizations in healthcare can apply ISO 9001 to set up and maintain a quality management system to raise the standard of care and increase patient safety. Many healthcare organizations pursue ISO 9001 accreditation. Second is ISO 14001 Standard Environmental Management System, which is healthcare institutions may use ISO 14001 to manage environmental impacts and elements, which is crucial in efforts to sustain healthcare.
Next, I will continue present about ISO related to health service. Number 3 is ISO 27799 2016 Health Informatics Information Security Management in Health using ISO IEC 27002. Within the framework of ISO IEC 27002, ISO 27799 offers advice on how to apply information security management to health information. Number 4 is ISO 45001 Standard Occupational Health and Safety Management System, an international standard for health and safety at work developed by national and international standards committees independent of government. Number 5 is ISO 50001 Standard Energy Management System. Ensure that your organization has a healthy energy management system, reducing energy consumption, environmental impact, and increasing profitability. And last is ISO 27001 Standard Information Security Management System promotes a holistic approach to information security, vetting people, policies, and technology.
In conclusion, a successful healthcare delivery, disaster preparedness, and environmental conservation all depend on the integration of health services with crucial natural information infrastructure. To improve their activities and services, health services rely on precise and timely data about the environment, natural resources, and climate. Health services and critical natural information infrastructure can benefit society in several ways, such as early warning and disaster response, disease surveillance and control, resource allocation, climate change adaptation, environmental health, epidemiological research, public health education, and the last one is conservation and sustainable practice. That's all from us. Thank you.